And thanks everyone for joining us this evening. Again, my name is John Nelson. I am honored to present Norwalk Hospital President Peter Cordeau, who will start tonight's presentation. Thank you so much for joining us.
Thank you, John, and welcome everyone. I believe this is our fourth Norwalk Hospital Community Forum. Today is December 1st, 2021, and if memory serves me right, in our first forum, we actually came together during quite a big snowstorm. So happy the weather is better today, but we're all in a different mindset as we work remote. So today I want to share with you some really exciting updates in Norwalk Hospital, and if you've not been paying attention for the past few years, there's been a lot of good things going on at Norwalk. I do want to discuss those safe care, our health institutes, what things look like moving forward, and then I'll transition to our Chief Strategy Officer, Jean An, to talk about our strategy and the Nuvance 2025 initiatives, followed by a lot of the awards and accolades we've received at Norwalk Hospital, and then I'll transition it over to our independent monitors over at PYA. So John, if you don't mind, we can transition right over to safe care. Safe care, as you know, especially in the era of COVID-19, is our top priority. We test all our patients that are scheduled for surgery. Our employees self-screen. We have hand sanitizer available everywhere, including the medical practices. Face coverings are required. And that's something, you know, as we deal with the general public, we're so used to going out without face coverings that everywhere in the hospital a face covering is warranted. We also offer virtual visits, and we'll talk a little bit more about that and some of the awards that we received. And visiting hours are back up and running for about 9 hours a day. And we do also permit visitation following our rules, and visitors have to have been vaccinated and show proof of a negative COVID test. John, if we move on to the next slide. As you're aware, all of the hospitals in the state of Connecticut, as well as across the country, are following a mandate from President Biden that we have all our healthcare workers vaccinated against COVID-19, and that is for the protection of our staff, patients, visitors, and community. You know, as we were preparing this slide, we were talking about the very highly contagious Delta variant, when now we have a new variant to worry about. And many of you have been watching the news today. You will see that there's been a recent press conference on the new variant, that the first patient out in California. So we'll continue to keep up our very strict practices and continue to take care of ourselves as well as our patients and community. Next slide, John. And if you haven't done it already, please get a booster. Encourage your loved ones to get a booster, whether it's COVID or Moderna. As you heard, you could swap and switch and swap the vaccines, or whether you had the Johnson & Johnson vaccine. We really want to encourage everyone 18 and older to get a booster, because it's your best way to protect yourself from COVID. And if in fact you do get a breakthrough, it is your best way to have a mild case from breakthrough. Still in our hospitals, the majority of patients that are being admitted are those who are unvaccinated. Next slide, John. Our COVID recovery program. And this is something that's really neat. This is something that we were one of the first, if not the first, in the state of Connecticut to do. And this is really for what a term that's been used called long haulers. This is how we care for those patients who are long-term, you know, adverse effects and chronic symptoms from COVID. So you could schedule your first visit via telehealth, and the physicians will work with you to treat you appropriately and then refer you back to your own primary care physician. Wonderful program. Dr. Chris Layrock, who we'll also talk more about in this presentation, was really instrumental in spearheading this, not only for Norwalk, which was our first site, but for the entire system. Next slide, John. And if you hadn't heard enough about vaccines, it is flu season. And we want to make sure, last year we had zero influenza, literally. I don't think we had a single admitted influenza patient in the state of Connecticut. Yet we don't want folks to forget, as we're all indoors again, we have the holidays, not forget to get your flu shot, because many people annually die from the flu and contract the flu, and the flu is also highly contagious. So please get your flu shot, wash your hands, keep your mask on. That's very, very important. So that's my public service announcement for you today before we start really getting into the nitty-gritty of the presentation. Next, John. And you can get into the next slide. We're going to talk about the Nuvance Health Cancer Institute. And with some really great news, both Cliff Connery, who's here, and Linda Versea have been with Nuvance Health and either legacy organization for years. And it is really a great pleasure to announce Cliff being the chair of the Nuvance Health Cancer Institute and Linda being the vice president of the Nuvance Health Cancer Institute. I've had the opportunity and privilege to work with both of them closely over many years. And we have an outstanding cancer program, and it's being led by two incredibly talented and compassionate individuals. Our program's grown by leaps and bounds. And as we go further through this presentation, you'll start to see just how much we have grown. Next slide, John. So this isn't a mistaken photo from a high school yearbook. This is actually Phil Gilbo, who is one of our radiation oncologists who is from MSK, Memorial Sloan Kettering, and is now permanently with us. And Phil is going to be, or is, our chief of radiation oncology. So he brings with us, specialization in multiple cancer treatments, including breast, genitourinary, gastrointestinal, head and neck, and metastatic cancers. So either Phil's getting younger or I'm getting older. Next slide, John. Same thing here with Dr. Fuang. We have some incredibly young, talented physicians here that have joined us in our cancer center. And the really impressive thing here is not only do you have young and talented people, but they're specializing in hematology and oncology and breast. And when you start to look at this research that this team is doing, and as we get farther and we start to talk about pancreatic care, it is absolutely amazing the degree of research that we're doing here at Nuvance Health and at Norwalk Hospital for really not a huge system. We're a real powerhouse in terms of the research and the work that we're doing. But next slide, John. A couple weeks ago, I had the privilege to kick off Light the City Purple. It is the first, hopefully the first annual, really to recognize pancreatic cancer awareness. The month of October is breast cancer awareness. And for the month of November, it's pancreatic cancer awareness. And, we had the ability to go downtown, meet with dignitaries, and really light a whole section of downtown purple. And it was really, really wonderful to not only see the folks there and the excitement around it, but to start a new tradition. And we've lit the front of our hospital purple. Everybody got purple light bulbs. I actually have a purple light bulb that I brought home that's in my house that we light over the night. And as I continue to talk about this cancer center, it's really just really heartwarming to hear. And Jim Naughton, famous actor, who actually is a great philanthropist and a great supporter of our hospital, kicked this event off because Jim's wife died of pancreatic cancer. And this is really important to Jim. And Jim was instrumental in raising the first $1 million towards research for this. So lighting the city purple in Norwalk really has a meaning, and it was a really special event for us. And we were happy to co-chair it with the Chamber of Commerce as well as the city of Norwalk. Next slide, John. And as we're on the theme of cancer, happy anniversary to our Whittingham Cancer Center that celebrated its 5th anniversary. Anthony Whittingham vowed to build a cancer center after losing his mom to ovarian cancer. he and his wife, Jean, made this a reality. And unfortunately, this year, their son, Andrew, who was on our board and had been a board chair at Norwalk, did succumb to cancer. And so we really owe the Whittingham family, so much. And we continue to work with Robin and their son, Adam and Catalina. And in this event, we planted over 200 daffodils, hyacinths, and tulip bulbs outside the cancer center. But you really see this family and group connection as we talk about Norwalk Hospital, our cancer program, and the people involved. This is really personal to everybody at the hospital. Next slide, John. In terms of technology, it's an investment in people, but as science moves on, we have to move on with it and be able to provide the technology and the most up-to-date techniques in order to diagnose and treat. And MagSeed is a great example where we would have needle-located biopsies in the past. MagSeed is a tiny metal seed that's put in place to locate the exact area of the cancerous tumor. So we make sure that we're in the right spot when we're doing lumpectomies, for instance, in the operating room. So just another great example of continuing to keep up with the technology to provide the best service for our patients in our community, and not having them leave our community for any additional services. Next slide, John, and you can actually go to, because we're going to talk about the medical practices. And at first, we have a new leadership structure for primary care, which is something we've been talking about for the past year. So it is really nice to speak to the group about the progress that we've made in the primary care arena. And we'd like to, announce Dr. Mastino as the regional medical director and Noel Bolton as the regional operations director for primary care. And as you will see in the next slides, John, if you don't mind, we have 3 more primary care docs in our area, all bilingual, all having different specialties within their own primary care specialties. So for instance, whether it's geriatrics, whether it's gender, it's gender identity for both female and male. And we also have a surgeon who's not on here, Dr. Chandler, who does a lot of this type of work. And this is a real issue and a real problem. And we really are excited to be able to provide those services again, locally in our community, for our staff, for our community. It is really wonderful. If you move to the next slide, John, we also, in terms of, and you may recall from the last town hall, we've had a significant investment in oncologic surgery. And Dr. Polakidis, as a thoracic surgeon here, really gives us a dedicated person in the Norwalk area. He and Dr. Fezbora are a presence in Norwalk, also a presence in Danbury, which is fantastic. And also Dr. Shah, as I was talking about gender identity on the previous slide, Dr. Shah also specializes in that field. So this gives us the ability not only to be able to, there's so much work that goes on prior to making a decision, if in fact, whether it's medical or surgical, you really need the expertise in this. And we have made a significant investment in this for our practices in primary care, as well as our community, as evidenced by the physicians we're sharing with you tonight. If you can go to the next slide, John. Nuvance Heart and Vascular Institute. So the next slide is interesting, and if you don't mind, John. So the cardiac tilt table is something that, for better or for worse, I've done, not by choice, but as a patient, and it's an amazing test and tool to be able to almost stand you up and lean you forward in a way to help diagnose certain cardiac problems. And in my case, it was, dizziness, lightheadedness, as this slide says. And it's amazing. And to have a positive test, you have to pass out. So it is not the world's most comfortable test, but I will tell you again, it is a great diagnostic tool, and a lot of people don't use these tools, and it's very, very effective in diagnosing some phenomenon that aren't easily diagnosed by an EKG or a stress test. So this is just one great example of what the Heart and Vascular Institute does, as well as really the totality of the services they provide to give you the peace of mind to have that right diagnosis. And I'm living proof of that. And I thank the Heart Center and the folks at the Heart and Vascular Institute for that. If we could move on to the Neurovascular Institute or the Neuroscience Institute, again, Norwalk Hospital, next slide, John, has been the really beneficiary of huge investment, approximately this whole room with the biplane is approximately a $5 million investment for the community, for the hospital. We not only do complex cardiology procedures because this piece of technology gives you a 3D image of the vasculature. So we can look at blood vessels, soft tissue, blood flow, but neurosurgeons, endovascular surgeons can take a 3D image of your head and remove that clot or coil an aneurysm in your head. We can do this right through your wrist. It is amazing technology. It's amazing to see. People are up and walking the same day and going home a day after. Life-saving, being done now at Norwalk, and it wasn't done prior to that. And all these patients would have to be transferred out of the community and or out of the system in Norwalk. As being part of a system, I think that's really important too, because it's not always Norwalk that's the recipient of patients from the system. Sometimes we have to send patients to the system, and the power of a system can't be underestimated. This great device, we were able to take a patient from Putnam Hospital a few weekends ago to be able to provide a life-saving therapy for them. And we are very good at utilizing our resources and making sure we can provide the best care for our community. And this is just one outstanding example of that. Next slide, John, moving forward. So the next slide, I get to have the privilege to announce Dr. Chris Layrock, who's been with us for a few years as the president of the medical group. And he's also been recently named the chief physician executive for Nuvance Health. Chris is an amazing physician, amazing leader, a wonderful person to work with. Had the opportunity to spend some time with Dr. Layrock today, and he's been instrumental in really bringing together not only both medical groups, but when you're merging two cultures and two systems, it's a lot of work and a lot of time, and he's got the temperament for it. He's the right man for the job. And so a big congratulations to Chris as we continue to grow, not only in Norwalk, but as Nuvance. And we can't do this work without working as a team. And he's a great example of a team player. So congratulations to Chris. Connecticut Children's in Nuvance Health. So we've had a relationship with Nuvance Health in varying capacities across the system. And it's nice to say that we have a network-wide policy through our neonatal ICUs, providing caregivers and providers to our Nuvance Health hospitals. And they do an amazing job in the NICU. They really, really do. They've been great partners in the NICU. They provide pediatric hospitalists. They're in our emergency departments. And for our hospitals with inpatient pediatric units, they are helping staff those units also. So we continue to work with Connecticut Children's, and we continue to really have a solid relationship and provide outstanding care in our local community. And again, we want to be able to provide the care that we are capable of providing locally. And if in fact we have to provide care of a higher level, we have the resources within our system to do so. So that's great news. We did have a public announcement about this. I want to say at the end of the summer, announcing this big relationship. So update on the Norwalk Hospital Pavilion, if we can, John. This, I'm very happy to say, is the largest project in Norwalk Hospital's history, 180,000 square feet, inpatient tower with extensive renovations to the existing campus also, because we really had to look at what were the critical needs of the unit versus did we have, real estate that actually met our clinical needs. This will include a mother and infant unit on the 7th floor with a beautiful view of Long Island Sound, with 17 private rooms, 6 bassinet well baby, nursery, and NICU that can actually flex. And this is important because the ICU is a similar model where the newborn nursery and the NICU have the ability to flex up and down as the need exists. So for instance, with the 5 NICU beds, that can flex to 7 easily with 2 more in the nursery as the gases are plugged in for that. So we took into account our average daily census. We took into account the changes in how care is delivered and what requires a neonatal ICU bed, but also took into account that how can we gain synergies with the design of the unit that allows us to operate more efficiently and yet provide that high level of service that we need for our patients. So that part will be housed in the new building. And then as we transition seamlessly, you won't notice it as the floors abut. The new 2 to 3 cesarean section rooms will be there, and all your laboring rooms immediately adjacent, and the on-call rooms. And then once mom delivers, they go back into the new building, and there's areas for the patients and families, and it's really, really well designed to meet the needs of today's families and the needs of today's NICU parents in there to be able to stay with their loved one during their time in the hospital. So very proud to share that. And now I would like to introduce Jean, our Chief Strategy Officer for Nuvance Health, and she's going to review the strategic plan for the organization. And then you'll follow back up with me before I toss it over to the folks at PYA. Jean?
Great. Thank you very much, Peter. And thank you all for joining us this evening. It's my honor to present to you our Nuvance Health 2025 Year 2 plan. I'm going to review our fiscal year 2022 plan here. Our vision is very much to improve the lives of every person in our community. And when we talk about the cascade to Norwalk Hospital, I do want to make sure that we spend a little bit of time talking about the fact that Norwalk Hospital has been in its community for over 130 years, established in 1893. As Peter has mentioned, we have been making major significant investments, both from a inpatient as well as an ambulatory perspective. You heard about our primary care and specialty investments as well. And so that is very much to serve the patients in our community for the long haul. Foundationally, in the blue, you will see that we are very much still about focusing on all of our foundational success metrics. The metrics that we've had previously, we continue to focus on, whether it's quality and safety, employee engagement, financial stewardship, they remain key focus areas for us. However, in addition, in terms of our multi-year plan, we do have 6 strategic imperatives that are areas of focus for us, both as a system and as well as a cascade down to Norwalk Hospital. They include person-centered care. We are very much about making sure that we're establishing a long-term relationship with our patients and our prospective patients. We are very much focused on primary care, as you've heard, in terms of the investments being made both at Norwalk Hospital and the larger health system as one key area for focus in terms of our network. Our third strategic imperative is ambulatory care, again, recognizing that our community needs various access channels to a large continuum of care that's offered both by Norwalk and Nuvance Health. Digital health, we recognize that there is a need for robust digital tools, technologies, infrastructure, such that we can support the care we provide to our patients in our community. Value-based care, it's very important to us at Nuvance Health that we are the highest value health system, providing high quality care at an affordable cost, and again, providing that at scale to large populations. And then network optimization, again, keeping our eye on advancing our health system and providing really excellent services for the patients and the communities that we serve. And so I'll talk a little bit about each of our strategic imperatives. There is a larger plan that talks about this in more detail, but at a high level, if we start with person-centered care, very much focused on how do we enhance and support our patients in terms of their journeys and their experience. And this area focuses on 5 key areas: our hospitals, including Norwalk hospitals, our emergency departments, outpatient surgery, as well as imaging. We focus on our medical practices, and then also on our institutes. And so Peter did talk about our institutes, which include cancer, heart and vascular, neuroscience, and again, that will fall under our network optimization as well. In terms of our second strategic imperative, primary care, again, very much a foundational area of focus, very much our area that we are focusing on both from a Norwalk Hospital and a Nuvance Health perspective. We recognize that there's a lot of demand that exists for our patients in the community, and so you can see that we're making the investments so that we can accommodate that demand. In addition, we are looking to make sure that we are addressing physician wellness and physician burnout, a number of initiatives underway there. And then also in terms of making sure that we have really great continuity of care for our patients. We don't want to be the health system where folks are plopping into our Fairfield area communities and then taking that care outside of this area. We are very much about focusing on providing that robust, comprehensive care continuity for our patients within the local communities. And so that referral keepage is very important, making sure that patients who are seen for primary care, and if they have other needs, that they're able to be seen by a Nuvance Health provider in their local community. So again, a big area of focus. Ambulatory care, a key channel for us as we move forward, again, in a way that is very consumer-centric. So we are looking to provide and accommodate patient volumes and care by building out our ambulatory network, and then also making sure that we are optimizing infrastructure. So accommodating patients when they need to be seen and making sure that we're focusing on that time to appointment. Digital health, I will tell you that this has been a big area and a big focus for Nuvance Health. We have put in a number of digital tools, technologies, platforms to make sure that we're opening our digital front door and providing digital capabilities in a way, again, that is very much consumer-friendly, consumer-centric. And so we are looking to build out our self-scheduled visits such that patients can come in and self-schedule at a time and place that's convenient for them, which also means that that infrastructure needs to be provided as well. So providing the direct book clinicians, so physicians and clinicians available to accommodate that direct booking by our patients and our prospective patients. Value-based care, I mentioned, Nuvance Health very much focused on being a very high-value health system, high quality at an affordable cost. Some of the mechanisms to do that are making sure that we are putting into place and executing further things such as annual wellness visits for our Medicare population, both in New York and in Connecticut at Norwalk Hospital, and then also making sure that we're meeting our closures in those risk gaps for chronic conditions and HCC coding. In terms of network optimization, very much about advancing the health system and providing those capabilities that are needed by our patients and our communities. And so you can see growing our institutes. Our institutes are very much focused on the areas of greatest need and greatest chronic conditions by patients. So again, cancer, heart and vascular, neuroscience, and then also making sure that coming out of COVID-19, which has had a lot of impacts for most health systems, is to make sure that we're enhancing our hospital's performance, including Norwalk Hospital. So again, a lot of focus in each of these 6 strategic imperative areas. Our second slide here, really talking about what are the common themes. It may seem like a lot, but at the end of the day, there are 2 common themes. So if we hit the slides here, that top layer really saying that we are here to make sure that we're providing for our patients and our communities by providing access for them. So that's that yellow layer. Regardless of channel or strategic imperative area, whether it's primary care, ambulatory care, digital or value-based care, or our hospitals and institutes, very much about accommodating our patients and their needs. And then secondarily, or equally important, is making sure that we have the workforce and the infrastructure to provide and enable that care. So again, at a high level, we wanted to present that to you to tell you that we are very much focused on each of these 6 strategic imperatives and very much invested in our Norwalk Hospital community to provide the care in each of these imperative areas for the future. So we thank you for your time, and please let us know if there are any questions. So thank you.
Thanks, Jean. So you're back with me. Let's talk about awards and recognition. And I think what's really impressive here as we go through this is all of this was done during a pandemic. So when you see how much we've accomplished over the last year, it is pretty darn impressive. So we remain a joint replacement center of excellence. We're a level 2 trauma center, and this is our recertification year. We received the Gold Lifeline Achievement Award. We're a primary stroke center. We're a stroke care excellence center. We're nationally accredited by the American College of Surgeons for our breast center, recognized as a metabolic and bariatric surgery for that excellence for our GI and our weight loss program, and American Heart Association Stroke Center of Excellence. If you go to the next slide, John, in addition, I showed you the cardiac biplane. Through that whole process, as we were getting it up and running, we were concurrently going through really the hard work of Michelle Liccardo, through a joint commission survey to be recognized as a thrombectomy capable stroke center. This is the first for Nuvance Health and only second in the state of Connecticut, all being done in the middle of a pandemic, all at a time when we were, really cutting our teeth with just pushing the envelope in terms of what we can do from a neuro standpoint. It's really, really impressive what the team has been able to do. So congratulations to them. And again, a real testament to the investment made in Norwalk Hospital. Next slide. Consistent with everything else, get with the guidelines, Stroke Gold Plus Award and Stroke Honor Roll Elite. Again, it's the same team, Michelle Liccardo and company, and Dr. Daryl Story and Paul Wright's the head of the service line, Chris Willie, the whole group, really, really growing a service line that was very pretty much just neurology centric, and have really grown this program exponentially over the last few years. Another award, next slide, John, we have the Mission Lifeline Gold STEMI Receiving Center Achievement Award, and that is your heart attack. You're coming with that crushing chest pain, and we received an award as a receiving center, being able to get you on the table and restoring that blood flow to your heart well within the ranges that are considered statistically significant. We've also last spring applied for elective angioplasty to do the same type of work in a much more controlled environment. This requires a certificate of need for the state, and we are still awaiting a response from the state on that. And that would only enhance more the work that we can do and the great work that we can provide locally at Norwalk Hospital. Next slide, which speaks a little about what Jean was talking with the investment in digital health. Here we have the Doctor of Distinction Award for telehealth. And when you think about pre-pandemic, we had pretty much a non-existent telehealth footprint. And then to be recognized a few years later is nothing short of amazing. The standing up of this platform and the buy-in and the ability to train on the fly all these physicians has been wonderful. It's been great for our behavioral health population. So many patients can get the care they need. Appointments aren't being canceled. And we just signed a contract that didn't make this presentation, but with a company called SOC, who we use for our overnight stroke reading. And they are going to do our overnight behavioral health screening. So patients aren't sitting in the ED waiting to be cleared or evaluated by a psychiatrist. So again, this is something that'll be spread across the entire system, and it'll start at the beginning of the year in Norwalk to provide 24/7 coverage in our ED for our behavioral health patients that are in need of a screening examination or a visit with the psychiatrist. Next slide, John. In terms of more awards, our own Dr. Amy Ahasik, the head of our pulmonary and critical care medicine and director of pulmonary rehab at Norwalk Hospital. Amy is also going to be on the Norwalk Hospital board. She was honored as the Female Trailblazer Doctor of Distinction Award. Well-deserved. She's absolutely amazing. And for those listening who are TikTok fans and the fans of the D'Amelios who are TikTok stars, Amy was featured as the recipient of the $50,000 check given to Norwalk Hospital by the TikTok star. I can't remember her first name, D'Amelio. And it was pretty amazing as we had the crew here and Amy was broadcasting live from Norwalk Hospital to receive that award. So congratulations to Amy. And she heads up just an amazing cadre of pulmonologists and pulmonology fellows that really helped us tremendously during this pandemic. And not to be outdone, next slide, our very own Dr. Richard Frank, who I had the privilege of co-hosting the Light the City Purple event. Rich is one of the nation's foremost pancreatic cancer researchers, and he's one of our very own here in Norwalk. So he's the chair of cancer research. He oversees our cancer trials, including original research in pancreatic cancer. One of his patients was there at the lighting, and he has been a pancreatic survivor, I want to say, for over 10 years, and he started his own fundraiser that's raised in excess of $250,000 to be donated to the Cancer Center. So great job by Dr. Frank. He continues to do that research. He continues to be passionate about it. And he's homegrown, he's one of our own, and we couldn't be more proud of the work that both Amy and Dr. Frank are doing. If we go to the next slide, this really dovetails on what Jean was talking about in talking about the overall cost of care. Norwalk was recognized by the Loan Institute for outstanding performance in 9 categories. And essentially, it's valuing the care we provide. Are we overusing testing? Are we overcharging for procedures? Everything about the delivery of care and the cost of care, we were the best in the state. And that is amazing. So as Jean described in her plan, here is a testament to what Jean was saying and the work that we're doing and how Nuvance performs against the competition. So we're very proud of this. We continue to work very hard on making sure patients get exactly what they need, not any more than they need. And we try to meet the patient where they are in terms of the treatment that they require. And now I would like to introduce our friends at PYA, who, if you've been on these other calls, are here, both David and Dwight, and I'd like to introduce them and let them wrap up the presentation, and then we'd be happy to take questions.
Thanks so much, Peter, and great to be here. My name is Dwight Tarwood. I'm joined by my colleague David McMillan this evening, and we're representing PYA, and we're serving as the independent monitor, monitoring Nuvance's compliance set forth in the agreed settlement required by the Connecticut Office of Health Strategy. And many of you have seen us before, like Peter said. It is our duty to report our findings to the community on a semi-annual basis. So we met with everyone this summer, and we're back this December for the next round of visits. So if we'll go to the next slide, John, and then one more. So kind of what we're going to get into today, and we'll be brief with our presentation here. We're going to first talk about kind of our role and kind of duties of what we're here to do and what we've accomplished over the last 6 months. We'll talk about our timeline for our semi-annual review, and it's important to know that this is actually our 5th semi-annual review, and the way our periods work is they end in March and they end at the end of September. So we'll be reporting on the 5th semi-annual period, which is actually April 1st of this year to September 30th of this year. Next, we'll talk about conditions that are relevant to that 5th semi-annual period. We'll talk about kind of our findings, and then next steps in a Q&A session if there is any. So next slide. So our role is while we are engaged and we report to the Office of Health Strategy, also known as OHS, we are retained at the sole expense of Nuvance Health. And as I mentioned earlier, we're responsible for monitoring compliance with a long set of conditions set forth in the agreed settlement. So later, I'm going to walk us through kind of the observations related to this period, and then that last bullet there, we're retained by OHS for a minimum of 5 years. So for kind of each 6-month period, this is kind of what our cycle really looks like. We're conducting on-site visits on a semi-annual basis. So that's twice a year. After that, within 30 days of our on-site visit, we'll furnish a written report, which goes to OHS. And then 60 days following the submission of that report, we are here for public forums, and that'll be in the Danbury, Norwalk, and Sharon communities. And this is actually our first one, and the other two will occur later this month. I skipped number 3 there. Number 3 is that we're required to meet with community representatives, which I'll speak on a little bit later. That's an annual requirement. And then lastly there, if Nuvance is out of compliance with any of the conditions, we'll notify OHS and Nuvance, and we'll work it out that way. So this is kind of our timeline for our last, 6 months or so. The first thing we've started with are the joint board meetings, and it's one of the conditions actually calls for semi-annual joint board meetings. So I've shown kind of when those 2 board meetings were held for 2021. The line below that shows when we developed and submitted our 4th period report, which was earlier this summer, and then the subsequent community forums for PYA to present those 4th period findings, the line below that. In May, we met with Nuvance leadership. We met with the hospital presidents and a few other individuals for an on-site visit. Well, we call them on-site visits, excuse me. They were actually virtual. They've been virtual since March of last year, just to be as safe as possible. The line below that, we met with Nuvance PFACs for each hospital. Those are comprised of informed representatives of each hospital and community. That stands for Patient Family Advisory Councils. So very productive meetings in October and November. And then it brings us to today. We actually finalized our report and submitted that to OHS this afternoon. And we're here on the same day presenting our findings to you and then to the other hospitals later this month. So before kind of running down this list, it's important to know that not all 22 or 23 conditions that are in the agreed settlement relate to each 6-month period. So this listing right here are only requirements for this past 6-month period from April 1st to September 30th. So we'll start at the top, and kind of 1 and 2 go hand in hand. It's condition 1 states that each Danbury and Norwalk Hospital Board must have 1 community representative each. Condition 2 states that 12 community representatives must serve on the Sharon board. So in the 4th period, we actually reported on this, that we reviewed those rosters and found that Nuvance was compliant with that condition. So what does that mean for the 5th period report? Well, those boards haven't changed. So still, yes, compliant with terms and condition for 1 and 2. As I mentioned earlier, Nuvance is required to hold semi-annual board meetings, which they've held 2 in this calendar year. So that's an easy check of the box for condition 3. Moving down to condition 4, this calls for Nuvance to make culturally and linguistically appropriate services available and integrated throughout each hospital within the system. And in the 1st period, we did a thorough review of these policies and concluded that Nuvance was compliant with those terms. And we've confirmed in this period, like last period, that those policies have remained the same. For condition 5, Nuvance must maintain charity care policies maintain charity care policies after closing, or adopt new policies that are at least as generous to the community. So towards the end of 2020, Nuvance alerted us that they are working to consolidate policies across the system. So we met with Nuvance in March to discuss kind of observations and recommendations. And then Nuvance ultimately provided this new policy to OHS at the beginning of May of this year. That new system-wide policy was implemented in July 1st of this year. And based on our review of the policy, we're able to conclude that the guidelines in that policy or at least as generous as the previous financial assistance policy. So that checks the box there as compliant with terms in condition 5. Number 6 kind of piggybacks off of number 5. It just states that Nuvance must provide written notice to OHS of these revisions within 30 days, which they provided notice in May. The policy was implemented in July, so that's greater than 30 days. Again, compliant with terms in the condition. So moving on to number 11 there, independent monitor must perform on-site visits, which we have. We met with Nuvance leadership, as I mentioned, back in May. We met with PFACs in October and November. 12B is kind of, we've boxed that around because that's what we're here to do today. We're here with public forums with Danbury, Norwalk, and Sharon. Again, this is the first one. Those other two will occur later this month. So moving on to 15, this one is, there's kind of several requirements that are involved with this condition. And one of them is that Nuvance is to meet cost savings goals for each fiscal year. That's 2020, 2021, and 2022. I saw David go off mute there. David, do you want to chime in, or do you want me to keep rolling through?
Well, I did want to just let those listening in let them know this from a contextual perspective. When you look at all these requirements, they're intended to be a measure by which the state, in this case, the state, is ensuring that hospital combinations to form systems like Nuvance allow for adequate protection of availability of care within communities. Now, there has to be, economically feasible to get that done, and so part of that economic feasibility in terms of how care is maintained in communities is accomplished through certain cost savings measures, because anybody that follows healthcare knows reimbursement to providers continues to be challenged. But often communities are concerned that those cost saving measures are going to mean significant changes in service levels that are available. So this document, when you take the settlement agreement as a whole, it does a nice job of balancing, maintaining that access to care. And tonight you've heard example after example after example of expansions of care, as a matter of fact, that have occurred, since the merger itself. But there are cost savings that can occur at a corporate or a system level as you garner some scale and certain resources. You heard a strategic planning presentation tonight where you're able to look at a system-wide strategic plan. And one example of how you can create some scale and multiple savings through planning efforts, for example, not having to occur at multiple campuses. So the idea here is that the organization was challenged to come up with what they would project the cost savings to be over those fiscal years that Dwight mentioned. As we reported previously, when we sort of began tracking those, it was challenging in the pandemic year to hit some of those cost savings, and no one could have predicted the impact of the pandemic. When we get to the 5th semi-annual period, we're actually in the middle of a fiscal year reporting. So really the issue here is not so much have the projections been the projections that were originally made, have the actual results match those projections or not, so much as have the reports been provided to OHS as are required. And the answer to that is yes. So when we get to the next reporting period, we'll be talking about, what are the results of that next full 12-month cycle as it relates to some of those cost savings that were originally projected. But the further we get away from those original cost savings that were projected, quite frankly, the more variability there's going to be because of environmental circumstances that occur from the beginning. Again, the idea here is the system operating in an efficient way that, quite frankly, is allowing for the reinvestment of those funds back into the communities and back into care. We'll continue to monitor this and report on it as we're required to do per the report. But in reality, what we can say tonight is everything was reported that was required to be reported, and that we will be looking at those annual results once they're available. We'll be talking about those in the 6th semi-annual review.
Thanks, David. So moving on, I didn't really have anything else to add on 15. For 16 and 21, it's kind of that those kind of both go hand in hand, and it's really just annual updates on enhancements, initiatives, and any sort of integration initiatives. And that Nuvance provided kind of a comprehensive report on both of these conditions, which were very, interesting and well done. So it was easy to say that they were compliant with those conditions. For number 18, this asks that Nuvance maintain sufficient OBGYN staffing levels, which they have. It is important to note that in September, Nuvance announced a plan to suspend labor and delivery services at Sharon. The timeline for that, which we've been made aware of, is around 8 to 12 months. And at this point, we don't have much else to report on that condition, other than that we'll continue to kind of monitor activities associated with that condition, as well as condition requirements in the coming months. That is all I had on that slide. David, did I miss anything?
No, I think we're wrapping up. Just, next steps will be doing our 6-period work. In fact, we've already sort of launched into that 6-period work, and some of the things that we'll have to report on during that next 6-month period. We continue to speak regularly with the management team at Nuvance. They've been a great team to work with, and always been very responsive to any question that we have. So we'll continue to have those regular check-ins, and we'll be back 6 months to make sure that we comply with the responsibility to make this information available to you and answer any of your questions. So I think with that, Peter, we are, other than answering any questions that may come across the chat, we're complete with our presentation.
Fantastic. John, do we have any questions?
We do not at this point, Peter. Thanks to you and to Jean and to Dwight and David. If anyone who's watching has any questions, we can stay on for a few minutes. You can submit them via chat, Q&A, or we're also streaming live to Facebook for any comments or any questions. Just give it a couple of seconds, and if not, we will wrap this up. And I don't see any coming through. So in that case, I'll just say thanks to everyone for joining us this evening, and have a wonderful holiday season, and have a great night.
Thanks, everyone. Good seeing everyone. So long.